A key part of the COVID relief bill creates the most significant changes to the Affordable Care Act since it was passed more than 10 years ago. Among other changes, some important provisions include providing larger subsidies to buy insurance, reducing deductibles, covering the entire cost of COBRA, the insurance extension program for those who recently lost a job, and giving states more money to expand Medicaid. The Congressional Budget Office estimates these changes could cost more than $90 billion over the next 2 years. Julie Rovner of Kaiser Health News watches all this closely, and she joins me now. Julie, thank you so much for joining us. So let's first talk about the ACA, the parts that affect the ACA. How does that money reach people? Tell us how it works.
Well, it basically boosts subsidies by about $35 billion. Now, this is temporary. It's just 2 years, but it will particularly help people at the very top and the very bottom of the eligibility thresholds for the law. People at the top right now, if you earn more than 4 times poverty level, that's about $50,000 for an individual, you basically get no help. There's this cliff where you suddenly have to pay everything yourself. They would change that so you would only have to pay 8.5% of your income. That could dramatically reduce premiums for people at that cutoff threshold by as much as half. Then people at the bottom would also get larger subsidies so that people up to 1.5 times poverty, about $19,000 for an individual, would basically have access to a zero premium silver plan. That's that middle level plan. So they're pretty significant increases.
It sounds very significant. And Julie, I want to ask you about Medicaid. There's enticement in here, as we mentioned, for states that have so far chosen not to expand Medicaid. How would that work?
There's a dozen states that have not expanded Medicaid under the Affordable Care Act, including some really big ones like Texas and Florida. Basically, what they would do is encourage these states by giving them a larger share of federal funding for their current Medicaid populations, not the expansion population. Again, it would be temporary. It would be 2 years in the hopes that maybe that sort of financial relief would encourage some of these states to go ahead and expand Medicaid eligibility upwards a little bit.
And then, Julie, and I'm ticking these off, as we mentioned, there's yet another provision here to help people who've been laid off from their jobs continue to receive this employer-paid health insurance, the so-called COBRA provision.
That's right. COBRA dates back to 1986, and it allows people to continue their employer coverage when they lose their jobs, but they have to pay the entire premium themselves, which can be many, many hundreds and sometimes thousands of dollars a month. So this is a very short-term provision that said if you've been laid off or if you've had your hours cut so that you don't qualify for coverage anymore, the federal government will pay 100% of your COBRA premium, but only for as much as 6 months.
And you were telling us, Julie, efforts are being made to make some of these changes, instead of being just 2 years, to be permanent?
Well, certainly they'll expire in 2 years, and clearly there will be a political fight. I imagine Democrats will want to continue them, and I imagine Republicans won't. And they're going to argue, they're going to basically decide who's going to take the political hit there.
And Julie, one other thing I want to ask you about. Republicans were aiming some of their criticism today, among many others, at this COVID relief bill, at what they say is a provision that would require $36 billion worth of cuts to Medicare. How do we understand that?
Well, this was actually a provision that was last put in by Democrats in 2010 to keep the deficit from exploding. And it says if you don't pay for new spending, then we will cut Medicare. And so that is, in fact, true. Now, Congress can and has in the past waived this. So, again, another political fight about whether they will let Medicare cuts take place or whether they will actually vote to waive those cuts.
But we'll see, is what you're saying on that last one.
Yeah.
All right, Julie Rovner covering all these healthcare changes in this new piece of legislation. Thank you, Julie.
Thank you.